Back live on In Focus, the deaths and injuries suffered by initiates will come under the spotlight when traditional leaders, surgeons and health practitioners meet next week. The CRL Rights Commission has also invited the Cooperative Governance and Traditional Affairs Department as well as the parents of victims to the inaugural National Customary Initiative Indaba. CRL Rights Commission CEO Edward Mafadza joins us now to tell us more. CEO, good to have you and thank you very much for your time. It is the most unfortunate situation in the country where every year we report on an escalating number of deaths at what is called initiation schools, which are meant to be carrying out customary practices. How do you see an Indaba of this nature responding to that challenge that you and I have sat around the table and discussed for so many years?
Thank you very much, Tabo. Maybe let me start by greeting you and the viewers at home. Yes, indeed, the National Initiation Indaba is responding to something that is very well known in the media and in communities, that all the time when we have the initiation, season, when the initiation season comes, we experience a high rate of young people dying in terms of the numbers every season. So we are coming to the initiation Indaba to try and, come with the intervention strategies in terms of what is it that we can do to alleviate or eradicate these deaths of young people in initiation schools. So it is in many ways in which we want to approach this matter. The first one is to try and say we want to eradicate a high, number of death rates during the initiation season. That is the purpose. And the second one is to say that we must create a conducive environment of acceptable norms and standards to prevail during the initiation season without compromising the lives of young people. We want to prevent illegal and botched circumcision schools contributing to high death rates in some regions. Because when we look at the statistics, many of the deaths are coming also from the illegal schools. Yeah. So we also want to ask ourselves a question as, the audience or the participants in the Indaba, to say what are the intervention strategies that we can come up with to assist victims of botched circumcision to regain their dignity. And again, we want to learn from the best, practice models from other provinces to curb high death rates, because there are, provinces that are doing very well when it comes to managing initiation schools. They have zero death, yet they admit so many, initiates. So we are bringing all these provinces together and say, let us learn from one another. What are the strategies that we can put in place together to make sure that even if I don't belong to that province, but at least we should be able to curb the deaths during initiation season. And of course,
how do we make sure that we don't just sit and have a roundtable conversation, but actually come up with practical, actionable items that will come out of this? Because, for example, you and I sitting here, we know very well that the number of deaths are as a result of illegal overnight circumcision schools or such schools being either supported by the parents themselves who take their children there, others saying their children are being abducted and taken to these schools. So we know these. Sitting around the table talking about them, yes, would be good, and maybe we'll get best practice. But what we do want is, how do we come out of this and then begin to act?
Tabo, we need to come up with a plan that is owned by all of us. Because you see, we're talking from different points of view, and our experiences are different. So we are hoping that we are not going to just have a discussion, but at the end of this, Indaba, we'll be able to come up with a sort of a program that will guide the different provinces in terms of enhancing their intervention strategies during initiation season, especially in the coming seasons, so that we can follow that, supported by the Customary Initiation, Act of September 2021. Many of the people, like you are referring to the parents, they do these things without necessarily knowing the consequences. They are not necessarily knowing that just to agree or just to support these illegal schools is a sacrifice they are making for their children. Some of them, they think these illegal schools, in their minds, they think it's a normal operation because some of them, they are bullied into these processes. It's not like everyone does this thing, out of volunteering or out of his own evolution. But you find that there are bullies who kidnap these children and go with them, and parents only know after. And they are left with no option because they are told that you must do this so that your child can be safe and so on and so forth. So part of this discussion is to say, how do we curb those kind of approaches and prevailing challenges that parents are also confronted with? The Customary Initiation Act gives the responsibility of the parents to be in charge of their own children when they are going to initiation school, so that they know what is happening, they know where they are, and so to make sure that their children are safe. So it is through this Indaba that we want to be open to everyone. We will also use it as an educative process for all stakeholders that are mentioned in the Customary Initiation Act, so that they know their roles clearly, and they must also know if things are not going the way they are supposed to go, what is it that they must do so that they can immediately get assistance. Yes. Hence, we have called different law enforcement also to be part of this Indaba.
So is that because of a lack of broad basic understanding of what the Act says, or is it because there is a lack of buy-in and comprehensive buy-in of what the Act says?
You must remember, Thabo, that when we are saying parents, some of them are unable to read and write. Some of them do not have this kind of comprehension that you and I may have. So they just go with the flow, and it is important that some of these parents, we put together, some kind of programs to educate them before their children are taken to initiation schools, so that they have a minimum understanding of what is expected of them and their children when they are undergoing this. And this can be managed at a local level, even by traditional leaders, because these things are happening within their jurisdiction. So I wouldn't say that is the issue of them not agreeing and to the requirements as outlined by the Customary Initiation Act. I would say it's because there's no one who's giving them that information properly for them to be able to make appropriate decisions. And I think this Indaba should be able to find strategies on how we make a very complicated information simple for those that are supposed to implement it and make sure that their children are safe.
So, I mean, you conducted your own, for example, investigation back in 2017 when you began to find some of those criminal elements that are creeping into this traditional practice of initiation. And part of our conversation, the things that we were talking about, for example, was how to deal with the money issue and how to standardize, so to speak, a fee that needs to be charged across the board by all traditional surgeons. How far did we go in as far as implementing that coming out of your investigations?
Thabo, I would say that some of the recommendations that we have made, we are happy that they were actually, incorporated to this Customary Initiation Act. But there are those that were not necessarily, considered, that would still want us to have a discussion in a form of this Indaba that is coming, and say, is it not time now? Because we can all agree that initiation schools have been commercialized, and people are, charging high prices and so on and so forth. And this is a source also of the deaths of young people, because there's competition. I must have so many numbers so that I can have more money. Now, it is time perhaps that the Indaba should also consider standardizing or price fixing of the initiation fees, because, so that it could be an equal level in terms of what we pay. Because now, if we are paying the same, the competition and the abuses of these young men can be limited. But as we speak now, people are looking for money than any other thing, and that is, creating a problem, because now they sacrifice the lives of the young men.
Yeah. And the final aspect, of course, that we've also debated quite extensively is the code of conduct and ethics. Is there something that you're going to be digging into there as far as the traditional surgeons and nurses are concerned?
These are some of the issues that we feel that if we have a code of conduct for these surgeons and everyone that is involved, it could go a long way as well. Of course, I would say the code of conduct must be aligned to the Customary Initiation Act that we have, and that will assist in the process. But these are the debates that must be part of the discussions at the National Initiation Indaba, so that, the Indaba itself is able to come out with resolutions that they understand. So I would say yes, it is time perhaps that we should deal with things that way.
Mr. Mafadza, I appreciate your time. Thank you very much for coming on tonight and helping us in the conversation. That's the CEO of the CRL Rights Commission, Edward Mafadza. April 24th until the 26th is the day in which, or days at least, set aside for the National Customary Initiation Indaba, which aims to highlight some of those areas which we have touched upon this evening.